So thinking about when to refer a patient, okay, for services for the ear, for the hearing, of course, you know that audiology and ENT work hand in hand. When to refer first to ENT. ENT obviously is the medical provider, so when you have a medical complaint like pain or pressure in the ear, oral drainage, or tinnitus, ringing in the ear, rapid onset symptoms, unilateral symptoms, a suspected infection or a history of head trauma, it would be appropriate to refer patients with those concerns to the ENT first. Audiology, patients can come directly to us with complaints of progressive hearing loss, tinnitus, reduced word understanding, or the complaint if their family is noticing that they're having problems communicating or that their hearing is changing, right? Because it's quite often it's other people that notice our hearing is changing even before we do ourselves. So typically, patients have a lack of awareness that their hearing is changing. Presently, only about 30% of people with hearing loss are using hearing aids. When they come for the initial testing, it's frequently because a family member is prodding them to come in, or there's a precipitating event. A precipitating event to me is like making a mistake in a work setting because of not hearing well. I have a patient that told me he picked up his son at the airport, but he got there at the wrong time because of his hearing. So that prompted him to come in to get it checked. Some patients will have a difficulty integrating or accepting the diagnosis of changing hearing, and they may overgeneralize it or blame other people for them not hearing well. Most people wait about 7 to 10 years after a hearing loss diagnosis to pursue hearing aids. Those that eventually move forward, certain factors involved in that decision is will their insurance cover it? Perhaps there's a cost-sharing method that's been put into place by their insurance company. They have to see themselves as using hearing aids and then take the step to do it, right? Every time we make a decision in life, it has to be done at least twice, once internally. We have to decide to do something, and then we take the step to do it. And then they have to make a commitment to coming back for their follow-up appointments to make sure that things are moving in the right direction. Ideally, what doesn't always happen, but what we would like to happen is that patients would have regular hearing screenings, and this would be done usually at the primary care's office. They would be appropriately referred by their primary physician to an ENT or an audiologist after failing a screening. They would bring a companion to share the experience. They would be open-minded to the results of the diagnosis, to the communication strategies presented by the audiologist, and then to review treatment options. They would enthusiastically agree to try hearing aids. They would return for follow-up with questions and requests for fine-tuning, reporting significant benefit from the technology and the appointments, okay, because you need both, and then return for regular device maintenance and service and testing on an annual basis at least. Some communication strategies for healthcare providers: make eye contact with your patient. Okay, we are all encouraged or really required to write very detailed notes about everything that we do in our electronic medical record, but it's also important to make eye contact, especially in the days of wearing masks. Using verbal verification, that's when you ask someone to repeat something back to you to make sure that they understand it. Giving information in writing, like the diagnosis, instructions, follow-up plan, and medication details, and then also getting the companion or the caregiver involved. Some basic stats about healthcare in Brooklyn. As most of us know, we are in an area of Brooklyn that is considered an underserved area for healthcare. So statistically, the life expectancy in central Brooklyn is approximately 6 years lower than the NYC average. Hospitalization for conditions such as diabetes, asthma, and other life-threatening conditions are double in our area than in the New York City average. In 2019, the poverty rate in Brooklyn was about 18% compared to this entire state, which is about 13%. Kings County encompasses many neighborhoods that the Health Resources and Services Administration has deemed as medically underserved, and a shortage of providers exists in primary care, mental health facilities, and also dentists. So reflection, how will I use audiology as a tool to improve care delivery and subsequent patient quality of life across the care continuum?